Too much charting, too little time. 62-year-old male presents with chief complaint of left lower back pain. Consider the diagnosis of Jesus Christ. I'm charting.
Sorry. Did I do something wrong?
Besides interrupting me, probably.
Then I apologize. I know that second year of residency can be stressful, so if there's anything I can do to help you. Like stop talking?
That's a great idea.
Yeah.
Consider the diagnosis of aortic aneurysm or dissection.
Got a new one for you in third chain.
I'm 20 charts behind, and the new attending is threatening to make me repeat a year if I can't catch up.
Crimea River, old lady with bad abdominal pain. Somebody's got to see her.
Dana, please do me a solid.
Holiday weekend. Westbridge is down in our waiting rooms on overdrive. I'm sorry, but your charting's going to have to wait until after your...
And what about your water intake?
Pause. Mrs. Randolph, you said you don't take Percocet every day, but when was the last time you took some?
Maybe 3 or 4 times last week. Yeah. Assisted living had a ballroom dance competition, and I tweaked my back.
Mm.
And
it stopped up for at least 5 or 6 days.
Mm-hmm. Painkillers can cause constipation.
I know. That's why they put me on a stool softener, and then they tried an enema.
And no movement.
Sip. And then they gave me this horrible drink.
Mag citrate.
Yeah, mag citrate. Made me puke.
All right, what's next, Ogilvy?
Let's get you an x-ray and see how we can help you, Mrs. Randolph.
Thank you.
Mastectomy, it could be small bowel obstruction.
Or worse. Not always, especially when you're in your 80s. Ultrasound was
Done with that good luck, Granny?
Ordered an acute abdominal series to rule out obstruction, still waiting on the x-ray.
Great, then you're free to treat our latest and greatest in SAS 16.
Oh, come on, Dee. It's like every time I get a moment to chart, I barely get a sentence out before I get
interrupted. Sucks to be you, but trust me, it sucks worse for the poor gal in 16.
I'm beginning to think you enjoy torturing me.
Perks of the job.
Ogilvy, let's go. Aquinas syndrome, but the motor and sensory exam were both intact in the
Our on-house coffer has pneumonia.
I'm cursed. Fucking cursed. Fuck.
Move her to a negative airflow room, start her on meds.
Call infection control and public health, and now you get to sign in as a patient and get your blood drawn for a quantiferin gold.
It's too soon to be positive.
Yeah, but you were exposed. You need a baseline test, and then again in 8 weeks to see if you convert.
And if I do?
Then meds every day for 3 or 4 months with regular blood tests to check for toxicity.
Jesus.
All right, let Dana know what's up, and for the love of God, mask up when you move her. Symptoms are consistent with lumbar radiculopathy at L4, L5, most likely.
For verified medication administration, I'm starting on right therapy.
Yeah, why do I even bother? Just fail me now. Okay. Get in touch with a social worker. They're going to want to do contact tracing and help her figure out transitional housing for when she's discharged.
Got it.
And make sure infection control responded. The people in the waiting room could have been exposed. You can take the mask off. You don't have TB. At least not yet. Expected job hazard. You can get used to it. 70% of doctors in training at urban hospitals get exposed to TB of this.
Fecal material?
A shit ton. Sorry, I had to be said.
So what, she needs an enema?
No, tried and failed, remember?
Yeah.
Time to dig in.
How are we gonna do that?
Oh, there's no we in disimpaction.
Shouldn't I observe first?
Nice of you to join us, Huckleberry.
What do you need?
Some help with a disimpaction.
That is a med student procedure.
Well, you know the old adage, see one, do one, teach one. Say hello to teaching young Ogilvy here. Keep going. Mrs. Randolph, in order to prevent this from happening again, I think you need a better stool softener. You can try Miralax. Just a tablespoon with a big glass of water every morning should do the trick.
Okay. Oh, sorry.
Passing gas is good. Means we're making progress.
Does that mean that I can stop?
No, nope, keep going.
Oh.
I'm catching up on my charting as fast as I can.
Why don't you give my generative AI app a try? Providers report increased job satisfaction, and you'll rarely have to stay overtime to complete charts.
Yeah? Okay. Yeah, I'm usually here at least a couple hours after every shift trying to catch up, so.
Sure, AI will make doctors pay, of course, all the while eliminating staff positions for attending and residents.
Oh, Dr. Robbie, I am not an advocate for.
Like, even when it's not your fault, sometimes it's worse knowing that there was nothing you could do. Are you?
Robin needs you both in trauma too, and I need you to discharge Sweet Patty and 13 as soon as you're done.
Can't catch a break.
I push you because I know you can take it.
Good lung sliding bilaterally.
Pupils equal in reality.
Vitals sound really good, Brandon. They call it an ankle breaker because you got to kick over a big fat single cylinder to get it started, sometimes 5 or 6 kicks.
Especially on a cold day.
Primary survey means rule out the life threats. Don't get distracted by lacerations or fractures. No free fluid in the belly.
2 letters. Tell her about D, Dr. Santos.
Disability. Wiggle your toes, sir, and we'll log roll them. What do we have? Helmeted motorcycle acrobat, 8-foot falls, standing on top of 5 riders. Primary survey normal, EFAS negative.
Another motorcycle accident.
Hello, sir. Okay, we will roll him in 3, 2, 1. Whoa.
Through the deep fascia.
Are you still coming over tonight? I think Whitaker is going to be playing Farm Boy again this weekend, so he's not going to be around.
I may need a rain check.
Hey, do you have an update on that neck bash patient?
Last I heard, Miller was doing an above-the-knee amputation with ortho.
Hey, did you hear about Louis?
Santos, what's up with your ileus patient?
Admitted to medicine, and before you ask, 13 has been discharged.
Great. 12 needs a doctor.
No, don't make me go back there. That disinfection left a smell and stunk up the whole hallway. Fill me in.
This is hologram. She was seen in triage. CBC and CMP came back normal.
Harlow, how are you feeling?
She has a headache.
Okay, what else? What is she saying?
I think she had a stomach ache, and she might have passed out.
I need to ask a million questions, and I can't do it this way, so just call me when IT comes down. If it's an open joint, he'll need a washout in the OR.
We could try a fluorescein injection. Okay, we'll need a wood slam.
1%.
Zepine ileus about an hour ago. Your resident reported no surgical history, but the chart says they've had an appendectomy. We're not admitting the patient without a surgery consult.
Who called it in?
And Dr. Trinity Santos.
Dr. Santos, you had an ileus patient. You neglected to mention a history of appendectomy.
There was no history of appendectomy.
It was in your note.
I may have forgotten to proof check it. I was using the app that Dr. Al-Hashimi suggested to catch up on my charting.
Wonderful. Ah, Dr. Al-Hashimi.
Yes.
Dr. Santos was just using your AI tool for her charting.
I need accurate information in the medical record.
Understood.
Okay.
Dr. Santos. Dr. Santos!
Yep, won't happen again.
Wait. Inumin mo to.
Thanks, Prilla. 6 hours to go. You got this. You're having a headache and abdominal pain? Would you say is worse?
My headache was terrible last week, but now...
Can you run that back again?
Sure. My headache was terrible last week, but now my abdominal pain... Oh.
God, come on, you piece of shit. Fuck. I'll be right back. Sorry. Yeah, well, as soon as you can, please. I need you to fix the VRI. Thanks.
Santos, I need you to pick up some more of these Westbridge diversions.
Sure, you want my firstborn, too?
Maybe. Will they know how to suture?
Intubate.
Dr. Al-Hashimi.
Well, I'd shake your hand, but my tube is ready.
And if I could find and secure the distant trachea, we have a shot at this.
Okay, keeping an eye on the stats.
Slow, smooth as fast.
You know, you can call me just to say hi sometimes. What's up now?
GSW with tracheal transection. Sats scanning the belly now.
Okay, just... I got it.
While you were playing with that airway, you missed a big bruise in the left upper quadrant.
He was wearing body armor.
High velocity.
Our VRI isn't working. Video relay interpreter? Yeah, of course I rebooted it. Wait, how are you gonna fix it if you don't know what the hell it is? Yeah, okay, whatever. Free minute I get?
I wasn't coming over for that. Good job in the trauma earlier.
Neil, can you talk to me? Post-ictal, but moving all extremities.
Pulse 137, BP 88/60.
What are you thinking, Dr. Santos?
Heat stroke, but consider sepsis or drugs.
Rectal temp is 104.6.
Okay, let's start with 4 ice packs on the groin and axilla. Should we do a full body ice bath?
That'll take too long. You have an Arctic sun?
Yeah, we do.
Get pads on the chest, abdomen, and both legs. That'll give Dr. Santos a chance to get caught up. Your R2 year can be challenging. You just have to keep grinding. What's your dispo plan for Mr. Scott?
ICU admission.
You should call neurology to consult.
Yeah, done.
Since it was exertional heat illness in a young person, the mortality is low. But non-exertional heat stroke in an elderly person, you need to worry.
I'll put in orders for repeat labs.
Good work in there.
Jesus Christ. Sorry. Giving new meaning to the nickname Crash, huh?
I'm trying to get to the bathroom for over an hour now.
Yeah, you and me both, sister.